Good afternoon, and thank you for joining me for Creating a Path Forward, Cultivating Growth Out of Trauma. My name is Lisa Rothfus, and I'm a psychotherapist here in Austin, Texas, with over 36 years of experience working with parents, children, and families. I specialize in reunification therapy and treating issues of alienation and estrangement in high conflict families. And I've worked for 9 years in the Texas family court system as a guardian ad litem, a parent coordinator and facilitator, a co-parent counselor, and a court-appointed reunification therapist. In my practice, I treat families struggling with mild, moderate to severe alienation. And I also offer an intensive 4-day reunification intervention for families suffering from severe alienation. But let's start today with an all too common scenario that I see in my office. A mom comes to see me and she's incredibly distraught. She's angry, she's scared, and she's feeling absolutely hopeless. She tells me she has been accused of sexually abusing her son about 6 months ago, and there is a temporary restraining order in place on her. An investigation was done by CPS and a detective from the Attorney General's office. She's had to hire 2 lawyers to defend herself, criminal and family. And although she was eventually exonerated of all charges, the damage had been done. She'd spent all of her savings, she'd mortgaged her home, and even borrowed money from her family. She was not sure how she was going to continue to pay her legal bills, and she knew there was a court date and a trial coming up. She's depressed, she said. I'm seeing a counselor. I'm trying to handle the constant emotional and psychological stress as best as I can. But she feels like she's never going to reunite with her child. And even if I do, she said, I don't know how we're going to work out these issues because my ex continues to tell my child that she was abused by me, even though I was exonerated. But the hardest part of all is that her daughter has now started saying she does not want to see her. She is desperately looking for a therapist to work with, her and her daughter, but she's having a hard time finding anyone that really understands alienation. This sound familiar to you? I have seen firsthand how alienated parents like this mom feel desperate, angry, and hopeless. And they often don't even realize that they've been experiencing trauma, which is defined as emotional and psychological response to a deeply distressing experience or situation. And the Diagnostic and Statistical Manual defines it as actual or threatened death or harm. Now, there are many different kinds of trauma, but alienated parents are dealing with what we call chronic trauma because it's prolonged and it's a repeated experience and it doesn't feel like it's ever going to end. So alienation is like being in a suspended state of trauma. And trauma can have lasting, devastating long-term effects on your well-being if you do not work on managing it. So, can trauma be managed? Yes, and we're going to talk about that today. The issues I want to cover today are understanding the aspects and effects of trauma, developing a plan for managing trauma, post-traumatic growth, and 5 major misconceptions about trauma. Now, before I start talking about that, I want to tell you that one of the best trauma experts in the world is Dr. Bessel van der Kolk. He's a psychiatrist and an author and a researcher and an educator based in Boston. And very interestingly enough, early on in one of my internships, I actually got to see and work with Dr. van der Kolk at McLean Hospital. And since the 1970s, his research has been in the area of post-traumatic stress. He has taken information from neuroscience, which I absolutely love, and attachment research to develop a study and a range of treatments for traumatic stress in children and adults. And he's written one of the very best books on trauma. And this book is amazing because it actually changed the way we think about treating trauma in the professional community. The book is called The Body Keeps the Score: Brain, Mind, and Body in the Healing of Trauma. But here are some important aspects of trauma that he talks about in his book. Trauma robs you of the feeling that you are in charge of yourself and your life, what Dr. Vanderkolk calls self-leadership. The challenge of recovery is to reestablish ownership of your mind and your body. Trauma specifically affects 3 parts of the brain, and we're going to talk about those today: the amygdala, the hippocampus, and the prefrontal cortex. And recovering from trauma does not mean that you return to who you were before. It is transformative, and it profoundly changes you. So let's talk about trauma and the amygdala. The amygdala is a part of the emotional or limbic system in the brain, and it's about the size of a walnut. There are actually 2 of them, and they're on each side of your brain. They can become particularly overactive in those who have experienced trauma. Now, the amygdala is overreactive anyway when we are dealing with emotional situations in our life. But if you have experienced long-term trauma, it can actually be overactive. This can cause you to become overly sensitive to threats in your environment or the thought of threats, and more prone to stress and anxiety. An overactive amygdala can cause you a lot of problems. One of those being hypervigilant. You are always on alert. You are always on edge, wondering if people are judging you. And it also puts you in a state of fight or flight, raises your cortisol levels, which leads to panic attacks, anxiety disorders, and something called avoidance coping, which involves avoiding people and places or situations that trigger that stress or anxiety. Let's talk about trauma and the hippocampus. Now you can see that little part in the brain, and the hippocampus is part of the brain that assigns meaning and associations to memories, including traumatic memories. So your memories are stored in the hippocampus. And the hippocampus plays a key role in emotional regulation and stress responses, all of which are very difficult for people who've been struggling with trauma. This may also explain why trauma survivors are more likely to struggle with mood disorders, mental illness, and other emotional problems. Let's look at what happens with impairments to the hippocampus. First of all, depression is very common and plays a significant role because you have a hard time regulating your emotions. You can have a lot of health problems because it raises cortisol levels and it impacts your immune system. And it's very difficult to handle chronic stress when you have impairments to the hippocampus. Now, trauma and the prefrontal cortex. This is the front of the brain, and this is one of the largest parts of the brain as well. It's also one of the last part of the brain to completely and fully develop. Sometimes you might have heard that it doesn't even develop till 25, 30 years of age. And the prefrontal cortex is responsible for most of the more complex thinking processes of the brain, like executive functioning. Executive functions include the ability to plan ahead, think things through, make good choices. You can see how an impairment in this area would significantly affect you if you were an alienated parent. Now, trauma affects the prefrontal cortex because you have stronger urges to make very poor choices and have less of an ability to resist them, saying things, doing things you would not normally mean to say or do. Learning problems. You're going to have problems at work. You're going to have a hard time focusing, concentrating, because you can't take information in to long-term memory when you're having trouble with your prefrontal cortex. You may also look almost like you have ADD. But I want to talk about the emotional brain versus the rational brain. Now, ordinarily, the rational brain inhibits and organizes and modulates the emotional brain. But with trauma, this balance shifts, making it much harder to control your emotions and your impulses. And the more frazzled you become, the more your rational brain takes a back seat to your emotions. This is why a parent dealing with trauma of long-term alienation becomes increasingly more anxious, agitated, angry, and afraid. What we refer to as sort of the 4Rs, 4As. The emotional brain has hijacked the rational brain. So let's talk about managing chronic stress. Well, to manage, heal, and recover from trauma, you have to do a certain type of therapy. And this is one of the things that Dr. Van der Kolk talked about in his book, the emotional limbic system therapy. And this is restoring that emotional brain to its usual quieter job of being in the background and restoring the executive functioning part of the brain, which really is connected to what he called self-leadership and self-confidence. But here's the most important thing. Restoring emotional regulation is absolutely key in managing the effects of trauma. Now, mainstream psychiatry and psychologists have paid very little attention to actually treating and teaching emotional regulation strategies or self-management techniques. They have relied more on medications and verbal talk therapies in our culture. They have paid very little attention to less conventional methods, which include things like movement, breath or body work, mindfulness or meditation, or visualization. Alienated parents absolutely need to learn strategies and techniques for managing their emotions and building self-awareness. Without doing this, you can cause yourself a lot of further harm in your relationships with your child, but also you can cause harm in relationships with professionals like judges and lawyers and therapists, guardians, custody evaluators. Because if you go to talk with them, go into a courtroom, and you're angry, agitated, afraid, anxious, you start looking like the one with the biggest problem. So to manage chronic trauma, you have to understand alienated parents experience trauma, and trauma affects your brain and your body. So how do you manage it? Well, to manage chronic trauma, medications and verbal therapies can be very helpful. There is a place for these, and I'm not saying that they should not be used, but oftentimes they need to be used in coordination with other kind of treatment practices. So we need to incorporate strategies and techniques that may not be as well known in the Western world and access the body and the mind. For example, yoga, Tai Chi, martial arts, all kinds of Aikido, Judo, Taekwondo, meditation, mindfulness, visualization techniques. So let's dive into managing trauma. There's 6 major practices that I'm going to present to you today. Meditation and mindfulness, movement and breath work, body work, CBT or cognitive behavioral therapy, and DBT, dialectical behavioral therapy, a relationships and community support, and finally, shifting into a resilient mindset. So let's talk a little bit about meditation and mindfulness, because I think this is one of the #1 ways to manage trauma. And it costs nothing, it's free, you can do it without paying a lawyer or a therapist. You can just learn to do this on your own. So what's the difference between meditation and mindfulness? Well, mindfulness is actually a quality that you achieve, and meditation is a practice. Now, you can achieve mindfulness without meditation. You can do mindful walking, you can do mindful washing your dishes or mindful eating. But meditation is actually a practice that you need to do every day. So when you're thinking about meditation, think of the brain as like a computer. Meditation de-excites the nervous system, and it gives the body a certain amount of rest and healing. And that's the hardware. It's healing from the inside out so it can function better. Mindfulness changes our operating system, our software. Mindfulness helps reprogram old fight or flight stress reactions in the body, and it can move you into a more relaxed mindset. You have to actively train your brain, though, to change the way you perceive the world. So, mindfulness, what is it? You've probably heard the word a lot. Well, it was actually popularized by a man named Jon Kabat-Zinn, who was one of the most popular Western writers on this topic. A long time ago, back in Boston, he created a program that was extremely cutting edge. He said, let's take mindfulness and see if we can use it to treat a lot of really serious issues that people are having with stress and anxiety. And this was called the Mindfulness-Based Stress Reduction Program. It was done at Massachusetts Medical Center, which is also another place I interned. And here's how he defines mindfulness: the awareness that arises through paying attention on purpose, in the present moment, non-judgmentally. Every single part of this definition is hugely important, but especially the non-judgmental part, because alienated parents often feel judged all of the time, and they judge themselves. Mindfulness teaches you a lot about how to become non-judgmental. You concentrate on the details of your environment or your bodily sensations. How does it help? Well, there's a lot of studies that have been done on mindfulness, and it's a quality that's associated with many mental health benefits, such as building self-esteem and self-acceptance, which makes sense because if you're not judging yourself all the time, you're going to feel better about yourself. And mindfulness meditation can reduce symptoms of post-traumatic stress disorder about 73% of the time. Research at Stanford University has shown that meditation can lead to a 30% decrease in stress-related symptoms that often lead to serious illness. And it reduces the cortisol levels, so you are less likely to move into fight or flight. It definitely improves physical and emotional health. Meditation, what is it? Well, meditation is a practice where an individual uses a technique to train your attention or your awareness and achieve an emotionally calm and stable state. Now, I'm sure most of you have heard a lot about meditation over the years. You probably tried it. You even said, tried it, not for me. And then you kind of let it go. But I want you to revisit the idea of starting a meditation practice. And I want you to think about it differently, because oftentimes starting a meditation practice is not as hard as you think. And a lot of times there are many different ways to actually meditate. You have to find the right one. And focusing the mind on a particular object, that's one option. Thought or activity, like a mantra, a breath, sounds, guided visualizations, because you can do guided or unguided, and full body relaxation, incorporating breath work and affirmations. Through meditation, you can achieve mindfulness. So how does meditation affect the brain? Like, why do we even want to do it? Because there are numerous research studies that have found that meditation is consistently associated with the actual changes in the brain, what we call brain morphology. You can actually change your brain. And remember, people who have been traumatized have significant changes to certain areas of their brain. Meditation engages those higher order brain regions, like the prefrontal cortex, which can help you to increase your awareness, your concentration, and your impulse control, and the hippocampus, that helps with the learning and memory, both of which can be damaged in chronic trauma. So it's really important to think about starting a meditation practice. But as we all know, we resist starting anything new, and sometimes we just need a little support and help. And practicing meditation, you can do it 5 minutes, 10 minutes, 15 minutes a day. But over time, if you can get yourself to do it, even a few times a week, you can significantly increase your brain and your ability to notice your behavior. This is what we call metacognition. You become aware of how you respond to things in your life. So it heightens your awareness, it deepens your thought levels, it decreases emotional reactivity, which is a big problem with alienated parents, not to mention the limitless number of emotional and psychological and physical benefits of meditating. So if you're having a hard time getting started, I want to offer you an option for how to do that. And this is a wonderful app that's found on both iPhones and Samsungs, and it's called the Insight Timer. It's free, you don't have to pay anything for it, and it's very popular and well known, has many different users. And the reason I like it is because it has all of these different kinds of meditations I was just talking to you about. You can listen to sounds, you can do guided, you can do breath work, you can do all these different kinds of things. And there's all different times. So if you just want to do 5 minutes a day, you can choose one that's 5 minutes. 10 minutes, slowly building your practice. They have many courses you can take as well. One I want to mention today that I really like. One is called Conscious Living Deep Breathing. It's 13 minutes. It goes by so fast you hardly notice it. And it incorporates a lot of breath work as well as some visualization and some positive affirmations. Another one by Wendy Chan, Mindful Breathing for Calmness and Clarity. And all of these strategies are calming strategies because there's various kinds of meditations, but the ones I'm going to talk to you about today are what we call the calming meditations. The first one is meditations where you can breathe and relax and the body. This is the one that I use the most in my practice because you can teach this very easily and you can teach it to yourself very easily. It's really pretty much performing a mental scan from the top of the head to the end of your toes. And we call it a body scan. I will have people breathe in deeply right into the face as they start and ask them to start relaxing, closing their eyes and relaxing their face, their cheeks, their jaw, and breathing in again and relaxing the neck and the shoulders and the solar plexus, and it just moves all the way down the body. Now, the most important reason for doing this is that people who are anxious and stressed and experiencing trauma hold a lot of tension and stress in their bodies, and they need to start learning where they hold the stress. So as you do it, you will start to notice certain places in your body that you hold the stress. For me, a lot of it is in the jaw and in my face. So you start learning how to relax the body, which is extremely important for healing. Some people like to use a mantra, all is well, or everything is always working out for me. Guided imagery meditations. These incorporate visualizations and affirmations usually as well. And there's one guided imagery meditation I encourage all of my alienated parents to do. To start every day this way, just do it for a couple of minutes. And that is seeing yourself having fun and reconnecting with your child. And I don't want you to just see it. I want you to feel it. I want you to get into the sensation of being so happy and elated to be with your child. You're actually getting your body to respond to it. There's another kind of meditation that was popularized by the Buddhist tradition, and it was taught by a man here in this country. He's very popular. His name was Thich Nhat Hanh, and he taught a lot about a loving kindness meditation. You start with actually imagining yourself, peace to yourself, and then you begin to send that peace out to other people and goodwill to other people in your life. It's like a ripple effect. If you're interested in this, you can go get some of his books, and he talks a lot about that. Listening and focusing on a particular sound is something that many of you may already do. You might go to sleep listening to the ocean sounds. You might love listening to the rain sounds. This is also a type of meditation. Let's go to practice number 2, and that's movement and breath work. Again, free and pretty easy to learn to do. And I want to talk about something that's become much more important in treatment of trauma in recent years, and that is something that relates to the vagus nerve in the body. And as you can see here, there's 2 of them. They are part of the autonomic nervous system, ANS, which controls the things your body does without conscious input, like breathing and digestion. And it runs from the brain into the body and connects with many of your internal organs. The vagus nerves are a major part of how your body and your brain function. By stimulating them, we can actually receive very powerful health benefits. And so there's been a lot of talk and a lot of work on teaching clients how to stimulate this nerve. We can directly train our arousal system to be calmer by the way we actually breathe. Or chants, sounds, these also are very powerful, and movement. One of the main ways that you can stimulate the vagus nerve is just through deep, slow belly breathing and body stretches. So we need to learn how to breathe calmly and remain in a state of physical relaxation, even when confronted with difficult memories, because this is the way that we learn to retrain the body system, the nervous system. Even when confronted with difficult memories, this is a tool you can use for managing trauma. So you are learning to strengthen what we call your vagal tone. Now, research from the National Institute of Health, which was also done by Dr. Vanderkolk, showed that 10 weeks of a yoga practice markedly reduced post-traumatic stress disorder symptoms in patients that failed to respond to medications or verbal therapies. But 20 weeks increased the activation of the prefrontal cortex. It helped to start to change the prefrontal cortex and to heal it. And part of this yoga practice did include breath work, stretches, and meditation. People with trauma experience something called alexithymia. And that's because they have this inability to identify what's going on inside in their bodies. It's like they become in a frozen state when you have anxiety. And you don't really know how you feel. But yoga is a practice that helps you to regain a relationship with your interior world and with your body. Because if you're not aware of what the body needs, you can't take care of it. And this happens a lot with people who are dealing with trauma. Don't really know how to read the signals from their bodies anymore. For example, you are eating and eating and eating because you don't understand that sense of satiation in your body. You don't register it. This is why cultivating sensory awareness through a lot of these practices is a critical aspect of trauma management and recovery. So, do you just have to do yoga? No, there are all kinds of movement that can be beneficial. Movements that retrain the core and the psoas muscles improve both physical and emotional stability. Now, the psoas muscle is actually linked to the emotional centers of the brain and can hold residue from trauma. As the psoas muscle is carefully lengthened and relaxed, you may notice that motions are released and healing from the trauma can take place. A lot of times you'll see that through massage. Stretching and dancing can also help with building this muscle. As you see the girl in the corner, she's stretching. This is a stretch you may be doing every day. You may do it at the gym. It may be part of a yoga practice. You probably didn't know how powerful it is, but it's something that can be easily done on your own. So there are a couple of really good YouTube videos on this. by Suki Baxter. In fact, she does a lot of videos on this area, and they're all very, very fun to watch. The vagus nerve exercise to rewire your brain from anxiety is a 14-minute video that shows you 3 very helpful stretches. They're very easy. They're not complicated. You can do 2 of them just sitting up in a chair. And you can incorporate these very easily into a morning routine. I actually will teach these sometimes to children that I'm working with. And she has one on how to stretch your psoas. But here's the most important point, and this is what was important about Dr. Van der Kolk's work too. You have to start moving to heal trauma. You have to take the initiative to incorporate some of movement into your life. So let's talk about breath work. What is it? Well, breath work is a term for various breathing practices in which you learn conscious control and breathing influences a person's mental, emotional, and physical well-being. The basic idea of breath work is to release toxins and stress when you breathe out and to nourish your mind and body when you breathe in. You're oxygenating your cells and you're promoting healing, and you boost the immune system this way. So I'm going to talk about 2 different kinds of breath work that probably you're pretty aware of. One is just diaphragmatic breathing. This is just abdominal or belly breath breathing, and it requires taking deep breaths into the diaphragm area and the belly, and this can be done by contracting the diaphragm. Now, I teach this all the time in my practice because people get very stressed and anxious when they come in. And you can do this before you go into court or you go into a session with a child you've been wanting to see for a long time. Just that deep breath. And I tell people that 3 deep breaths like this starts to elicit the relaxation response in the body. So it's very powerful. Another type of breathing that's taught quite frequently for people who are dealing with stress and anxiety, and actually is taught to our armed forces and special forces, is what we call box breathing. This is one of the simplest and most common forms of yogic deep breathing. And it basically requires breathing in for 4 counts, holding for 4 counts, breathing out for 4 counts, and resting for 4 counts. This is a wonderful way to visualize the box and the breathing when you're feeling stressed and anxious. So let's talk about body work. So we're going to talk about top-down versus bottom-up approaches to treating trauma. Top-down is when you're using your thinking brain, your neocortex, to access deeper physical, mental, and emotional, right? Talking therapies, positive affirmations. In the West, we most often use top-down healing methods. But we also need to incorporate now bottom-up healing methods, where you connect with the body and its various feelings and sensations, and you create change in the brain by doing this. So things like massage, body work, EMDR, which many of you may have done in your therapy, and somatic experiences. So the most natural way to calm the body, believe it or not, is gentle touch. Now, I know a lot of people who've been through trauma sometimes don't want to be touched, but this is something you can eventually work through in your treatment process, because mindful touch grounds people. It allows them to discover tensions they may have held for a very long time in their bodies due to chronic stress and trauma. Clinical research demonstrates that restorative practices such as massage therapy and various kinds of body work will improve immune function and digestion, will strengthen the vagal tone. Remember, we talked about that, the biggest nerve that runs in the body, and increasing heart rate variability, slowing the heart rate down, and teaches the nervous system to self-regulate. And there's lots of different kinds of body work. I've just put on here a few, but there are so many different kinds. There's sacrocranial that works with the head. There's myofascial release, which is a fantastic form of body work if you have not tried it. Reflexology, which probably many of you have. Shiatsu. And one of my very favorites is Thai massage because it incorporates acupressure, passive stretching, and yoga postures. Lots of you may have actually done acupuncture or acupressure as well. And if you've ever done that, you know that after a little bit, after they have inserted the needles and they've been in there a little bit, you begin to feel this profound sense of relaxation in your body. And then probably a lot of you have done Swedish massage. But the interesting thing about massage is when you're doing it, oftentimes people do release deep emotions. So let's talk about practice number 4. Cognitive behavioral therapy and dialectical behavioral therapy, which obviously are going to be top-down approaches. So, 2 kinds. These are the kinds that we found to be the most helpful in treating trauma. And cognitive behavioral therapy helps you become aware of your negative thinking patterns so that you can view challenging situations more clearly and respond to them in a more effective way. And then you have dialectical behavioral therapy, which is a modified form of CBT. And its goals actually teach people how to live in the moment, or what we call mindfulness. So they incorporate that into their teaching strategies. And they develop healthy ways to cope with stress and regulate emotions. So DBT's main goals are learning to use mindfulness, so they teach you a lot of strategies for that, learning about interpersonal effectiveness, learning to manage and tolerate stress, and learning to regulate emotions. So the one thing that's extremely important about the mindfulness piece is learning to be non-judgmental and learning to identify and observe your thoughts and your feelings and emotions without judgment, and focusing on how to improve your stressful situations, learning to self-soothe. In my practice, I will help people make an entire page of activities that are self-soothing, from taking a bath to getting a massage to playing with your dog, doing something physical, taking a walk. All of these things are self-soothing, but a lot of times we don't think to go and do them when we're feeling so stressed. And actually identifying ways to distract yourself, which also is sometimes a very good way of handling those incredibly big emotions in the moment. So, to heal traumatic stress, you need to restore the proper balance between the rational and emotional parts of the brain. Healing from trauma requires finding a way to stay calm and focused even when you're starting to experience that agitation, that anxiousness, that anger, and learning to maintain that calm response even when the triggers arise. So finding a way to be fully present and engaged with your life and the people around you, and not get stuck in the memories of what happened in the past and your fears of the future. So, is DBT effective in treating trauma? Well, research has shown us that it's extremely effective in treating trauma, and probably even a little bit more effective than CBT. So this is what's important. This is the message that I think Dr. van der Kolk was really talking about in his book. We have to expand our thinking about healing from trauma, because you need both bottom-up and top-down therapies oftentimes to heal chronic stress and trauma. But a thing that's really important to remember is you have to actually take the initiative to do these things, to incorporate them into your life, and start to make them part of your normal, everyday schedule. So let's talk about practice number 5, and that's relationships and community support. The single most important trauma mitigator is having a good support system. Research has shown us that traumatized human beings can best recover in relationships when families and loved ones if they are not judgmental. The role of this relationships is to provide a physical and emotional safety, which is what you will feel as long as you don't feel like you're being judged or criticized. This helps to insulate you from feelings of shame and judgment, because alienated parents are always worried about what other people are thinking or what other people are saying about them because they don't have a relationship with their child. And these people in your life, they can bolster your courage to face the situation that you're in each day. And parents that are feeling alienated are often afraid to talk with friends or others about their situation. That fear of being rejected, that avoidance pattern we talked about. You don't want to go and see people maybe you saw in your past because now it will trigger that feeling of loss. But there's another important thing about healing relationships, and that's that being with loved ones releases the hormone in the body, oxytocin, which is what we call your feel-good hormone. And it protects you from anxiety and stress and illness because it reduces cortisol levels. And the interesting thing about oxytocin is that of all the hormones in your body, oxytocin trumps every single one of them. And if your oxytocin levels are extremely low and you don't have regular intervals of oxytocin coming into your body, you are going to start to experience some very serious side effects from stress and anxiety and illness. But beware of a support system that only dwells on the negative. Be sure that the emphasis in your support system is on healing and self-care and hope, because negative thoughts are addictive. And you don't want to spend all of your time talking with your loved ones about alienation, your depression, your sadness. So the sixth practice that I want to talk about is shifting into a resilient mindset. Research done with trauma sufferers show us that recovering from trauma requires learning to shift into a resilient mindset. This means cultivating qualities of acceptance, compassion, empathy, resourcefulness, determination, courage, flexibility and openness, mindfulness and awareness, and forgiveness. To do this, we have to start establishing what I call the new normal. We have to look at things like our repeated negative thoughts that are so common for people that are dealing with alienation. You have to beware repeated negative thoughts. And because they contribute to chronic stress, trauma, depression, and anxiety. And you have to become consciously aware of what's happening with them. And here's the really unfortunate part. Negative thoughts are addictive. Scientists have actually discovered that negative emotions have an addictive quality that trigger the reward centers in the brain. So the more you focus on the negative, talk about the negative, the more you start triggering those reward centers in the brain. And you feel like you're rewarding yourself when you're succumbing to negative emotions. And neuroscience research has also taught us that what fires together, wires together. Brains get good at what they do. Negative thoughts create channels in the brains. And that thinking can become your default. If you do a lot of negative thinking, talking, discussing about all of this stuff with people in your life, you're wiring your brain to be good at negative thoughts. And your brain also gets good at seeing the negative in all kinds of situations. So focus on anything positive. That's important to shifting into that resilient mindset. You've got to find something positive in your life to focus on. Alienation is traumatic because it can color your entire life. But you have to actively decide to train your brain in a new direction. You can lay down new neural pathways. You have to shift your thoughts away from focusing on what you've lost, the time you've lost, what you're missing, that sadness from not having your child in your life, and what isn't fair, because so much about this does not seem fair. Steps you can take in developing a resilient mindset. Well, first of all, you need to notice your repetitive negative thoughts, which is why CBT and DBT and meditation and things like that can help you to do that, because you've got to notice anything to actually change it. And you have to be aware of a catastrophizing, which is where you fixate on the worst possible outcome and you start thinking about it all the time, every day. You have to make a conscious decision to shift from negative to the positive. And you have to have a lot of help to do that. Got to really use some different resources and skills to do that. So notice your negative bias, your repeated negative thoughts, and your catastrophizing. You have to bring awareness to these habits of the mind, and you have to catch yourself when you're slipping into them. Notice what your mind does when it goes to this worst case scenarios. What if I never see my child again? What if it's never going to work out? So I want to talk a little bit about something else that I think is really important, because even when we go through traumatic and difficult experiences, we absolutely can come out of them, like we said, transformed and changed. And we can have even some things come out of it that may be positive in our life. So post-traumatic growth, or PTG, is trauma, because trauma can be cruel and destructive force, or it can be a vehicle of transformation. It has a sort of a dual nature to it. Trauma can keep us immobilized and feeling hopeless, or it can teach us how to cultivate resiliency. It can lead to newly defined psychological state that's called post-traumatic growth, and its ability to cultivate resiliency. There is a wonderful book called Bouncing Forward. It's written by Dr. Michaela Haas. It's called Transforming Bad Breaks into Breakthroughs. And she is a scholar, and she is also a 20-year student of meditation. The interesting thing about her book is that she's talked to many, many different trauma survivors. And she's discussed with them, how did you get through your trauma? And from that, she developed this book and talks about post-traumatic growth. This is a theory that explains transforming trauma, and it was developed by the psychologists Richard Tedeschi and Lawrence Calhoun in the mid-1990s. It holds that people who endure psychological struggle following adversity can often see positive growth afterwards. So what is post-traumatic growth? Well, it occurs during conditions of severe rather than low-level stress. It's accompanied by transformative life changes, and it's experienced as a process or an outcome. It requires challenging and reconstructing basic assumptions about your life, beyond that of your previously held views. And you look at, for example, future with your children and your grandchildren. Well, they may not be what you had imagined, but you can help yourself to come up and evolve into a new way of thinking about it. So going through post-traumatic growth, you may develop a new appreciation of life, a newfound personal strength. You may see an improvement even in your relationships. You may see new possibilities in your life that you didn't see before. And you might even undergo certain spiritual changes. So references for PTSG, Richard Tedeschi, Lawrence Calhoun, here are some of the books that they have written about this. And there's also a very good article about post-traumatic growth in Psychology Today. This book also has, or this particular article also has a PTG inventory and a scale. So you can really look at where you are in your post-traumatic growth and give yourself a score. And in the post-traumatic growth inventory, there are 21 different items, each of which fall into one of the 5 factors: relating to others, new opportunities, personal strengths, spiritual change, and understanding of life. Here are some things that actually contribute to success with PTG. One of them, there's certain personality traits that are very, very helpful with PTG. And one of these is an openness to experiences. People who are more willing to invite in novelty, have curiosity about life, and eager to try new things are often people who really can benefit and discover post-traumatic growth. And people who are extroverts. People who like to be in higher activity are more likely to take action in the aftermath of trauma, reach out to people, seek support. These people are also very likely to be influenced and have post-traumatic growth. Well, alienation and post-traumatic growth in many ways do go together. Parents who are in the early stages of being alienated are less likely to experience PTG. But parents who have been alienated for a long period of time are much more likely to experience PTG. And many of you who have been in this chronic state of trauma for a very long time, you may already be experiencing some of this. So let's talk about 5 major misconceptions about trauma. Well, the first, trauma is a one-off horrific event that changes you forever. Second, trauma always leads to PTSD. Trauma is always a disorder. Trauma has to happen to you directly. And trauma changes your brain forever. So let's challenge these misconceptions. First of all, trauma does not have to change you forever. There is ample evidence, much of what I've shown you today, that recovery from trauma is very real and very possible. There are lots of ways to heal yourself. Trauma doesn't have to lead to post-traumatic stress disorder, and trauma itself is not a disorder. It's an adverse experience that may lead to a disorder if you don't take care of yourself, if you don't take the time to heal yourself and start incorporating some of these practices into your life. Trauma does not have to happen to you directly in order for you to experience its negative effects. As you can see, watching other people around you go through traumatic experiences. And trauma doesn't have to change your brain forever. We talked about that today. There are many ways that you can heal your brain from trauma. Resiliency is actually the most common response to trauma. So in summary, don't let trauma manage you. Develop a plan for managing chronic trauma. Look at yoga, movement, breath work, visualization, guided imagery. Just start to make a plan about even small things you're going to do to change some things in your life. And remember, it's hard to change because when you want to start doing it, you find all the reasons and all the excuses not to change. So you really have to maybe have some people around you help you to commit to it. Engage in top-down practices, DBT, CBT. These are great ways to start looking at your repetitive negative thoughts, your catastrophizing. You do need to understand these if you're going to change your brain. And start engaging in bottom-up exercises, yoga, massage, breath work, meditation, movement. Put trauma in a new light. Cultivate that shift, that mind shift of resiliency, and bring more positive thoughts into your life. Like I said before, find anything positive to focus on. It might just be one little thing in your life that's causing you to feel good. That's the thing you want to focus on. And seek out support from others, because relationships are the single most important protection against trauma. You need a support group. That's one of the reasons why conferences like this are so important, because you can really reach out and feel that you are with people who are not going to judge you. But you also need this consistently ongoing in your life. Well, thank you for joining me today. Here's some information if you would like to get in touch with me. Email contact@lisarothfus.com. I do have a website. I encourage you to go to the website. You can find out more information about me, about my services and what I do. And I also do other YouTube videos. So if you'd like, please go check them out. And there are a lot of other topics that I speak and talk on. And I just want to thank you for being here today.